Let's recap on study design. If we observe an exposure, those studies are called observational research studies. If we intervene and if we assign the exposure or a drug to a population, those studies are called interventional or experimental research studies. In observational research, we define the type of study as to what is measured first, the exposure or the outcome. A case control study starts with people who have an outcome, such as lung cancer, and it looks back at exposures. A cohort study starts with people who have the exposure first. They look at smokers versus non-smokers and they follow them up over time to see who gets the outcome. A cross-sectional study looks at exposures and outcomes at the exact same time. In interventional studies, we probably all know that the gold standard is the randomized control trial. Randomization removes a concept called confounding, which we will discuss in a moment. So just to tease this out, imagine in the 1940s, clinicians were noticing an association between smoking and lung cancer. This was anecdotal. So Dolan Hill in 1950, they performed a research study. They started with the outcome first. They found patients who had lung cancer and they asked them if they smoked before. The exposure. For the comparison group, they observed another group that was age and sex matched, and they asked them if they smoked before. The risk difference between the two groups was assessed, and this is a case control study. One obvious bias here is recall bias in this study design. So the tobacco lobby jumped on this bias and they said that the association was spurious. So the study investigators decided to do a new study from 1954. They measured the exposure first in smokers, and they went on to measure the outcome in smokers and non-smokers. So they waited until lung cancer developed. So obviously this takes a long time to perform a cohort study like this. Ultimately, the risk difference in those two groups showed that there was association of smoking with lung cancer, and this ultimately showed the causal association of smoking lung cancer that we know of today. I will not go through the concept of causality in this presentation, but all observational research is prone to something called confounding. Confounding is when a hidden variable influences both the exposure and the outcome. And if an association is found between an exposure and outcome, well, it could be the confounding variable that is the causal factor in the association chain. And that's why we don't rely on observational research alone when deciding on treatments, especially medications for patients. It is the reason also that we say association does not equal causation. So enter the randomized control trial, the gold standard of testing our interventions and therapies. Randomization splits a population into an intervention group and a control group. If done appropriately, randomization eliminates the concept of confounding because the confounding variable is randomly assigned to the treatment group or to the control group. So we only believe treatments if they come from well-conducted randomized control trials. What about systematic reviews? They are studies of studies. If we're looking at a treatment or a drug, it could be that a systematic review of randomized control trials would be the best study design, but it could be a systematic review of cohort studies if we're looking at a prognostic question.